I'm Rosanna Basarci. I'm the Program Team Manager for Acute Cardiac Care Unit and the Critical Care Resource Team in the Cardiac Sciences Program of WRHA. So we're using the measurement and monitoring of safety framework to address all of our safety issues now and have really made it a hub in our unit.
We started the measuring and monitoring of safety framework initiative 18 months ago. It is a fast-paced acute area, as you can imagine, and so the focus for us, as would be any other area very important, is safety.
I think the measurement and monitoring of safety has really helped us focus our safety discussions around one hub. So our patient safety board is where we meet, we have our huddles, but I think the staff really now feel safe putting a ticket up and know that it'll be addressed. Before we started our MMSF journey, we were not putting in as many RL6s as I would have thought, and as a new unit, we were only built in 2016, I heard people were afraid of doing that because from other sites they thought it was punitive. So we have worked through that, and now people really feel safe in bringing their questions, they put them on the board. I think it has really helped us with the dialogue of patient safety and brought it to the forefront of the unit, which is awesome.
One of the biggest challenges I think that we've faced is governmental uncertainty and staffing. It does not allow for a lot of time to do the planning, and with staff turnover, it's hard to maintain momentum. You almost start again every time the core players change. That would be my biggest challenge in this.
Well, being a separate unit, we came in almost 3 months after the heart cath lab, so we felt kind of behind to start, but then we caught up. You're always coaching, your changes all the time. So you will lose members of your team, and how do we focus on that? You keep coaching and you bring other people in, and I think finding some champions to begin with, and that way they can start running things when you're not there, and I have found that that has really been quite helpful for us, is to identify certain champions and not all at the same level. I have a champion in an educator, I'm a champion, CRNs are a champion, now I'm looking for staff to be champions. We are bringing in a patient in our quality group, so different avenues so that people are all on board knowing a little bit more and they can help coach out too.
Success looks like being able to approach anyone in your organization and have them be able to identify the framework and to work through issues that arise, with the focus on patient safety, using that framework.
I think patient safety has changed for my unit in that it's at the forefront now. People aren't afraid to bring it up. I have stat chats every morning with the charge staff, which I've changed part of my questions and put all the 5 dimensions of the safety framework into them. So every day we talk about the 5 dimensions and where are we at today, starting with sensitivity to operations, and it really kind of gives a glimpse to everybody who's coming through. This is how we focus our day now, and I think that really has helped to focus our team.
I think one of the things that I'm most proud of in the heart cath lab is that, like Roseanne's unit, the RL6s were seen as being punitive and not having enough time. Now we do safety huddles 4 days a week, and the staff have come to recognize that these what used to be exercises, perhaps in futility, are really valuable. It gives us data to be able to address the issues and see where there's patterns and anticipate going forward how we can make changes so that we can keep patients safer.
I think people always had questions. Staff have questions, they ask the CRNs or they ask myself, and we would find the answer, and then the answer somehow would get back to that staff member but not shared across the board. So now in integration, implementation, all that kind of stuff, we bring it back. So the CRNs, if there's been a question, we send out huddle highlights weekly. So we actually send out by email all of our huddles that have happened. And so we actually write in there, if there was a question, we write the answer in there so that the entire entire staff have access to these questions, and that the person who asked, who might be off now for 3 days, will get the closed loop feedback. So integration and learning is really what it's about. If we can't learn from the mistakes or the harm that we've caused, what is the point? So it's really good to have that closed loop kind of information now. How do we get information back to the staff, which is something I ask every day. How do we get this information back to the staff? So it's been really positive for people to get an answer and to be able to share that. You know, we've been sharing it out. So Cardiac Sciences leadership has been aware of this. We have presented to our Nursing Leadership Council, which involves clinical nurse specialists, educators, other managers from the units, to start to introduce the language. And we're even talking about making our agendas in Nursing Leadership Council have some of the measurement and monitoring of safety framework embedded in there. What has been some past harm? How can we address that? Is it reliable? So we're really trying to spread it out throughout cardiac to start. It's a different way of looking at safety and kind of embedding it in everything we do. In my unit, ACCU, we're also working it through for accreditation prep. So some of our required organizational practices are ulcer care. So we've incorporated that in our safety board with an MMSF focus to kind of bring it all together. It is all about patient safety, so integrating it all together. And then we've shared that out with the others, so from leadership down to other units. We don't own it. It's, if you want to use part of it, that's great. So sharing is a big part of it.
Patient safety has become a dialogue that we start our day with. I think that with keeping it in the forefront and having all of the disciplines that are involved hands-on with the procedures that we do, with all the different perspectives, having an opportunity to discuss and problem solve the issues that have arisen in the last 24 hours, or any issues that we foresee happening throughout the day. It's certainly improved patient flow, staff morale, patient safety.
I think it's got to become a new way of life, and that's what it's done. We will continue to work on safety items using the measurement and monitoring of safety framework, but we've also started to collaborate. Like the Heart Cath Lab and ACCU, we've started timeout procedures for complex cases. So the two teams come together to have one report out so that everybody on the team knows what occurred, what some of the risks are, what was happening, what's good, what's bad, that kind of thing, so the whole team is aware. We are now working with another unit to spread the framework, 5A cardiology, because we transfer a lot of patients there. So they're starting to talk with the language as well. And so I just think, you know, the more you spread out, the more you use the language. We hear that critical care regionally is now starting to spread out the message about measurement and monitoring safety, and we work a lot with the ICU because we're in ICU as well. So I think the more that we spread out, the more that we will continue to use the language, the more that it's embedded in everything we do. We have it now in our quality, we have it now talking about nursing leadership. Like, as we spread it out and use the framework in our daily activities, I think that's one way to sustain.
I think what I've realized over the 18 months is that there is no going back. Once you see this and change your focus, there is no going back to what it once was. Patient safety is the whole focus. And people want to do better, want to contribute. Nobody comes to work wanting to do a bad job. And we are looking after somebody's mom, somebody's dad, somebody's brother.
I say that to the management and monitoring safety framework is a good place to start, really focusing your safety conversations. If the staff feel safe, so do the patients. So I think we've really made a strong journey, and we'll continue on that journey today.